A dietary supplement derived from citrus fruits may help reduce swelling and pain after total knee replacement surgery. Swelling is a common complaint among the 800,000 people who have the surgery annually, but there are currently no medications that effectively control it, and ice packs and compressive bandages have limited success. In a new study, researchers tested a supplement called Diosmin, which has been used to decrease swelling in the limbs of patients with vascular issues. 330 people undergoing total knee replacement were randomly assigned to either a 14-day course of Diosmin after surgery or no treatment. Both groups were given standard pain medications. Those who took Diosmin had reduced swelling at the knee, calf, and thigh up to 14 days after surgery, and less pain with knee movement according to the results. But resting pain, knee function, and inflammatory markers were the same in both groups. The authors say these results provide preliminary evidence that Diosmin is a safe and effective treatment after total knee replacement, but more research is needed to determine exactly how it works to reduce swelling and pain.